In this video, I'd like to review back pain treatments from first-line treatments like exercise, nutrition, supplements, chiropractic care, physical therapy, to epidural steroid injections, facet and sacroiliac joint injections, to more involved procedures such as radiofrequency ablations, nerve stimulators, as well as new regenerative treatments, and then also all the way to surgical solutions. The first step of a good treatment plan is an accurate diagnosis. Assuming no red flag signs and symptoms that point to a more serious medical problem, we'll put out a video on red flag signs and symptoms and give a link in the description so we don't have to go over them here. Assuming no red flag signs or symptoms, then treatment often starts with therapeutic exercises designed to stretch the mid and lower back, stretch the hip flexors and the hamstrings, and strengthen the core stabilizing muscles. The goal of the exercises is to ultimately take the mechanical pressures off the spine by supporting the spine better so that the spine can rest and heal. Therapeutic exercises can be performed with home exercises like the ones we made a video about, and again, we'll put a link in the description. Or even better, therapeutic exercises can be done in physical therapy with the therapist working directly with you. Nutrition and supplements can also be helpful. Eating an anti-inflammatory diet and maintaining a healthy weight in particular is certainly a good idea for your spine, and it's frankly just good for your overall health as well. Anti-inflammatory supplements such as curcumin, omega-3 fatty acids, bromelain, boswellia serrata, and tart cherries can all have a role to play. The limitation of supplements, or frankly anything that you take by mouth, is that only about 2% of what you ingest orally will actually get to your spine. So anti-inflammatory supplements or even medications may be having a general anti-inflammatory effect in your body, which is good, but the amount of anti-inflammatory effect on your spine in particular is going to be inherently limited. When pain persists, there are a wealth of treatment options. It's at this point that an accurate diagnosis becomes essential. And if you haven't already gotten an MRI, you're going to want to get one. About 40% of chronic lower back pain comes from an annular tear inside of the intervertebral disc. When this is the case, transforaminal epidural steroid injections can be helpful to relieve the inflammation from around the disc and/or nerve roots. When the inflammation is alleviated, it's vital to pair this injection approach with therapeutic exercises. The medication from any injection will inevitably wear off, and when that happens, the mechanics won't have changed. So injections can help confirm a diagnosis, and they can also provide a window of opportunity to take away the inflammation, where the patient can then use that window to work on exercises so that the mechanics are slowly changed over time so that the inflammation doesn't return. About 30% of chronic lower back pain comes from facet joint pain. The facet joints are the hinge joints in the spine. They allow for flexion and they resist extension and twisting movements. A steroid injection into the facet joints can take away the inflammation from the joints, and this can be used as a window of opportunity to allow again for therapeutic exercises. When facet joints are the cause of the pain but the symptoms persist or recur despite an injection, then the definitive procedure to treat facet joints is called radiofrequency rhizotomy. Radiofrequency rhizotomy, aka an ablation procedure, is a procedure where radiofrequency energy is used to deinnervate the nerves that innervate the facet joints. So it's like someone's trying to make a phone call, but the cord's cut so you can't hear it. The facet joints might still be inflamed, but if there's no sensory nerve to tell the brain about the inflammation, then you don't feel the pain anymore. Often those nerves regenerate in about a year, and then you have to deinnervate them again. The sacroiliac joint is the third most common cause of chronic lower back pain, accounting for about 10 to 15% of chronic lower back pain cases. The sacroiliac joints can be treated very similarly to the facet joints. An injection into the joint can take away the inflammation and allow for therapeutic exercises. If that fails, radiofrequency rhizotomy can then be employed. Additionally, the sacroiliac joint can be fused as well, though this is typically not as necessary because burning the joints is much less invasive and still very effective. It's important to note that when an evidence-based algorithm is employed, most cases of lower back pain can and will be successfully diagnosed and treated with some combination of what we've already discussed. I feel like it's important to emphasize that this has to start with an accurate diagnosis. And it's also important to point out that when and if injections are used, they be used in combination with targeted therapeutic exercises. Even a radiofrequency rhizotomy procedure should ideally be paired with exercise so that if and when the nerves do regenerate, ideally the mechanics have improved over time so that the inflammation and the pain doesn't return. And with all that said, some cases of lower back pain will be recalcitrant or difficult to diagnose in the first place. A relatively new approach that's worth considering for these more difficult cases is something called a peripheral nerve stimulator. Now, nerve stimulators that are placed in the spinal cord and in the peripheral nervous system have been around for a long time. However, peripheral nerve stimulators have gotten a lot better in recent years, so they're worth revisiting and considering for more difficult cases of back pain. The main thing that's changed with nerve stimulators is the battery and the material science technology has vastly improved. What a peripheral nerve stimulator is an electrode that's placed by a peripheral nerve, and this electrode essentially hijacks the peripheral nerve that innervates a portion of your back. And this hijacking of that nerve is able to then distract your brain from the pain. You see, sensory nerve fibers are larger and faster than pain nerve fibers. So the electrode by the sensory nerve gives sensory input to this peripheral nerve, and that sensation goes to your brain faster than the pain fibers. The brain, in response to seeing so much information coming from a portion of the spine, under the gate theory of pain, says that it's not interested in receiving more information from that part of the body. So when the pain fibers finally get to the brain, the sensory gate to the brain has been closed and the brain doesn't acknowledge the pain. Clearly, this approach isn't going to fix the problem, but it does offer a potential terrific distraction from the pain so that you just don't feel the pain anymore. Regenerative treatments have also become very popular for lower back pain issues. Personally, because of their expense and the lack of data relative to other things, I generally hold the regenerative treatment options in reserve for those cases that aren't getting better with more tried and true treatments. However, when necessary, regenerative treatments can be very effective. Their main downside really is the cost. Now, these treatments include PRP, prolotherapy, exosomes, bone marrow aspirate concentrate, and mesenchymal stem cells, to name perhaps the most common ones. The hallmark and common theme with all of regenerative medicine approaches is that you're injecting something that is designed to stimulate the body to basically repair itself. Now, PRP is probably the most common and the most studied regenerative treatment for back pain. PRP has shown some efficacy for discogenic back pain, facet joint pain, and sacroiliac joint pain, although larger studies are ongoing and, quite frankly, larger studies are sorely needed. PRP is a treatment where your blood is aspirated, and a special centrifuge is then used to spin down platelets and their growth factors, and then this aspirate is then injected back into the painful site, again with the idea of stimulating the body to ideally repair itself. Surgery for back pain is less common than you might think. The main place for surgery for lower back pain is a fusion surgery for discogenic back pain, and also for a condition called spondylolisthesis, where the bones have slipped on top of one another. When patients have sciatic pain or other neurologic issues from nerve roots, surgery is more common. But for axial lower back pain, meaning back pain without radiation into the leg, surgery is definitely much less common. And finally, acupuncture comes up as a question for back pain treatment. There is some, but not a lot, of evidence that acupuncture can help chronic lower back pain. My personal feeling about acupuncture for back pain is that when done in competent hands, it should always be safe and relatively pleasant. So if it's covered by insurance, it certainly shouldn't hurt. So I think it's fine to try. Ideally, and probably most appropriately, acupuncture could be used in combination with other treatments, particularly physical therapy and/or therapeutic exercise. Okay, I hope you found this video useful. If you've enjoyed it, if you've learned something from it, please remember to like the video, subscribe to the channel, and please tell a friend who might find benefit from this channel as well. And as always, if you have topics that you would like for us to cover in a future video, or if you have any other comments, including if you'd like to share your own experiences with back pain treatments, then please leave a message in the comments section. As always, I wish you all the best of health. Thank you very much.